friends. Arsha, as we were discussing, will be presented with two presentations. The patients will be presented with either the constipated or with the loose stools. So Binna Varchas is the loose stools and Malavadata is the Vibhaddhamala is the constipated, and Binna Varchas, if it is without blood and only frothy stools is there, then it should be treated as Vatajatisara, whereas Binna Varchas with blood should be treated as Pitta Jatisara, and for the constipated you should treat it as Udavarta, and based on that I suggested yesterday, and many of the drugs are used. So commonly we use Triflow Guru, then what you call the Ashognavati, and these are some classical the drugs, but most of the time I believe all of you will be using the patent drugs because they are easy to they are easily presented to you, and you'll be adopting them. No worries, no issues for that, but you should assess, analyze the drug and their particular what you call the karmukata. Based on that you should what to select the drugs, and that should be based on the two types of presentation of the arsha. And coming to the the most of the drugs you can see here, okay, the Eranda Prashtahartik is the commonly used in the Gujarat for as an Anulomana, okay, Vatanulomana, and for Sukarichinartha. So Eranda Prashtahartik is commonly used, and the other drugs which are Vatanulomaka, many drugs are there. It will be too lengthy if I go on taking the names, but the only basic idea is that I told either as Udavarta or as the Atisara you should treat. And when it comes to the see these particular drug what to call the administration will be in the first degree and initial stage of the second degree, but don't make a false claim that you will be curing the piles or the hemorrhoids which are even third or fourth degree or second degree later stage of the second degree piles. Don't claim like that. So because you will be defaming the Ayurveda as well as you will be defaming yourself, because ultimately you are not going to get a result without the particular procedures like either surgery or parasurgical procedures like Kshara or Agnikarma in case of the later stage of the second degree as well as third degree and fourth degree of the hemorrhoids or the piles. And for external piles you are supposed to go for simple ligation and excision, or the Agnikarma can be done with the thermal cautery or red hot probe. And for internal prolapse mass, when they are pitta jarsha, that is bleeding, as well as they are purely covered with the mucous membrane and they are second degree, and in the early stage of the third degree you can go for kshara karma, okay, that is a classical what you call the method which has procedure which has been mentioned by the Sushruta. And if you are not acquainted with kshara karma, you can go with the kshara sutra ligation, and that comes as if as the earlier part of the hemorrhoidectomy only, because there you will be only ligating and you will be leaving the pile mass to shed off after 7 days or after the necrosis, okay. And when it comes to excision hemorrhoidectomy, if you have got better what you call the anesthetic support, then I suggest you people to go for hemorrhoidectomy under spinal anesthesia. Many times local anesthesia is attempted, but that may lead to some of the complications like the shock, neurogenic shock, as well as the bleeding is not controlled, then it may lead to hypovolemic shock. So that care should be taken. And for kshara karma, which is supposed to be practiced, and I advocate kshara karma because it can be right from the first degree till the earlier stage of the third degree, you can use kshara karma. That is the advantage of that. And other than that, many of the things are there, like infrared coagulation is done, that is done in the first degree piles, and initial stage of the second degree piles it will be useful, but not in the later stage of the hemorrhoids. And when it comes to what you call sclerotherapy is again for the hemorrhoids, and that is also in the first degree and earlier stage of the second degree. Again in the later stage of the third degree, fourth degree, it will take more time to shut off, and that will not give much better result. And cryosurgery already it is outdated, no, don't go for that. And other laser surgery is in the practice now, so I am not acquainted with the laser surgery, so I am not an expert to suggest about that. But rest of the things, as a kshara karma, if you learn, that will be an added advantage for you people to treat the piles at lower cost without complication, and anybody can do it, and even under local you can apply it. So for further this one what you call the training, you can go anywhere wherever the trainings are conducted for the Kshara Karma. Okay, so that is all about the Arsha and Sadhya Sajata and all the things. You can go through the classics and accordingly you can decide. And there, whatever the asadhyas have been given, that is Antarvali, that is the third internal vali, if it is occurring and it is long standing and all the doshas are much in the what you call the they are more potently aggravated, then that is asadhya, and that most of time will be the carcinoma condition of the rectum and the that because the antarvali, the internal which has been told, so it will be usually the carcinomatous condition of the rectum, and even the chirakalina, and which is easy to bleed on touch at the lower anal canal, that should be the anal, that may be the anal carcinoma, so don't touch it. Okay, so either you get it biopsy done or send it for the expert if you are not expert in dealing with the carcinomatous conditions. And that is all for the Arsha. And Patya already discussed. Ask the patient to avoid the curds and potato, brinjal, then curd, this one, what you call, the yellow gram, and the all the tobacco products as well as tea. Okay, and Divasapna should be avoided. Ratri Jagana should be avoided, and even what you call the Vyavaya should be avoided during that period. So that is all about that. Thank you for watching this video, and stay tuned for some other disease as well as some technical what you call legal aspects of the practicing Ayurveda in my future videos. And have a good day.